Okay, so to start, I'm just going to remind you guys of our three claims. First, our significance claim, that animal testing is cruel and inhumane. My opponent argued that because of regulations, testing isn't cruel and inhumane. I'd like to read you off some examples of some testing that was considered humane. One was a study done by the New Iberia Research Center in Louisiana, in which they were testing self-mutilation, in which there were tearing, gaping wounds into the arms and legs of chimps, and there was video footage found showing infant chimps screaming as they were forcibly removed from their mothers. In the same experimentation, they found that in the films that these chimps were having their skulls opened and they were dying while their brains were being looked at. And this same center, they were found to have more than 338 possible violations. Another example is a professor at Oregon Health Science University received a grant for $9.5 million, and he was testing obesity. And what he was doing was he was overfeeding mother chimps and then forcibly removing the babies from the womb and then testing to see if they had any symptoms of severe anxiety. Another statistic is that in 2010, 97,123 animals suffered from pain during experimentation because no anesthesia was given for relief. And this statistic was provided by the U.S. Department of Agriculture. Our second claim is that animal testing isn't scientifically accurate when later applied to humans. A quote from Dr. Francis Collins, who is the director of the National Institute of Health. He stated that the use of animal models for therapeutic development and target validation is time-consuming, costly, and may not accurately predict efficacy in humans. In other words, it's more work than it's worth, and it doesn't necessarily work. Furthermore, in another study, it was found that 92% of animal-tested drugs are rejected later in clinical trials, and 50% of those drugs that do eventually reach the market are later removed or they have to be retested because they're found to harm patients. And 96% of those problems that they find in patients, they did not see any results of the like in animals. And lastly, our solvency claim that alternatives are more effective in the skin. My opponent cited some pig research with skin cells, and it is found that epiderm, an in vitro derived from cultured human skin cells, was found more accurate in identifying chemical skin irritants than traditional animal tests. In comparison to other studies that use animals, in comparison to a test that used rabbits, the in vitro was 40% more accurate. Lastly, my opponent also stated that because this research that we are citing as more effective was derived through animal research, and we say, yes, that is true, but because we have this research now that is more effective, why would we continue to use the less effective animal research? It's more effective, and an example of how it's more effective is Neves, an organization that is pro in vitro, determined that in a synthetic skin, they were doing testing with that, and they were able to get results in as little as 3 minutes to up to around 4 hours, unlike animal testing, which can take weeks or even years. It can also, because it's much shorter, it will also save a lot of money because it's much shorter. So just to summarize, it's inhumane. Animal testing isn't scientifically accurate when we apply to humans, and it's more effective. We have new alternatives that are more effective, and if we put this plan into place, it'll save our country a lot of money and it'll be more productive.